Indiana Attorney General Todd Rokita taking aim at Indiana's COVID data, calling on public health officials to address, quote, deficiencies identified. He instructed his staff to prepare an analysis of the state's data following comments made on WSBT-22 more than 2 years ago in December of 2021.
I don't believe any numbers anymore, and I'm sorry about that.
Really?
But they're politicized.
The Office of the Attorney General returning to Mishawaka over the weekend to follow up on those claims. The analysis pointing out what Rokita's office outlines as flaws, including inflated death count, unsound positivity rates, detrimental lockdowns, harm to Hoosiers' mental and physical well-being, and devastating impact on student learning.
We looked at nearly 145,000 death records, for example, to come up with the conclusions I'm going to share with you.
The report claims that the Indiana Department of Health's official management performance hub over-reported COVID-19 deaths by 10.9% in 2020, 7% in 2021, and 12.5% in 2022. Rokita says they compared death counts reported on the MPH website to the number of death certificates listing COVID-19 as cause of death from the vital records database maintained by IDOH. Is this a problem with any other illnesses, or are you only seeing this with COVID? Did you come across this with, for example, the flu, if somebody has the flu and then dies from complications?
The thing is, we didn't look for other correlations or anything like that. It was beyond the scope of our study. But you have to understand, the flu is, number one, more or less known to us. It certainly has different variations and stuff, but it's not as scary as this Wuhan virus was. It was an unknown, and so we have to account for that. But we also have to account for, and again, I'm not saying that this was the motivation of anyone, but the fact of the matter is, the federal government, through various pieces of legislation, was putting, what I say, money on the street.
Rokita claims two major problems with positivity rate data, including the health department attributing multiple positive cases to the same person. Rokita claims the state reported a positivity rate of 30% during several months of 2020, but his office's analysis believes that rate was less than 5% during every month of 2020. Rokita also says decisions on restrictions were based on a sample group that were not representative of the whole population. The governor at the time had said that if there were such inaccuracies, he would consider that fraud and that it should be handed over to the Inspector General. At the time, I believe you said this isn't about fraud at this point, it's about inaccurate numbers and political agendas causing doubt. I'm wondering now that this research has been conducted if your opinion has changed.
No, because when you talk about things like fraud, you're talking about an intention. You're talking about a culpability in someone's mind. And that wasn't what we investigated here.
I'm John Paul. Thanks for watching. Here's another video for you to watch. Also, please take a moment to subscribe to our channel.